Everybody, while we're waiting for the other panelists to arrive, I'd just like to say apologies for yesterday for overrunning the schedule. We had a really interesting day's conversation, and we actually got as far as the 11th session, and we're just about now to complete the session for the summit. Which is titled "The Link Between LPG and Health: Progress in East and West Africa." Now we have Elizabeth Muchiri from the Global LPG Partnership, who will be presenting this presentation and discussing this issue. But we also have other celebrated guests from the Kenyan industry as well, and I will talk to you about Dr. Manyara Irungu shortly when we introduce him. So first of all, Elizabeth, welcome, and imagine that you're picking up from where we left off yesterday, and we have nearly 50 people tuning in. So welcome back, everybody, and I'm going to pass over to Elizabeth Muchiri, who's going to be picking up this topic for the next 15 minutes or so. Over to you, Elizabeth.
Thank you, Mr. Tyler. I appreciate, and I can see Alfred has already put my screen on my presentation on the screen. It's a very, very short presentation, and what I've done is to look at basically LPG in East and Central Africa, or rather East and West Africa, because Cameroon is between West and East. Some studies say it is in, others say it is in West. I have to talk to the Cameroonians. But I've basically looked at our partners. The Global LPG Partnership works with others. And in this particular case, I've looked at the work that we are doing in the Clean Air Africa, a UK-based organization that is looking at the impact of LPG in East Africa. In Africa, and they have done some work in Cameroon, they have done some work in Ghana, they're doing some work in Kenya, and in the near future they're also looking at doing some work in Uganda. Fred, you can move to the next slide. So we all know that there have been very numerous studies that show that the use of solid fuels and kerosene result in negative health impacts, acute respiratory illnesses, mortality, particularly for under 5 years, children under 5 years. Some non-communicable diseases such as high blood pressure, and some studies even indicated diabetes and so on. And while in the past few decades, particularly in Kenya, in the last 30 years, we've been working on the improved cookstoves, which we have established that they provide fuel and efficiency, but not enough reduction in household air pollution, which is short called HAP. For LPG, when the combustion of LPG leaves no particulate matter, particularly the black carbon, and it's the only fuel, combustible fuel that complies with the World Health Organization guidelines in terms of PM 2.5 emission levels. That is below 10 microns. Next slide. So the Global LPG Partnership, I believe a number of you already know about the Global LPG Partnership. It works with developing countries to assist in a rapid and sustainable adoption of LPG for cooking, mainly to prevent the 4 million annual deaths that are already known, 4.3 million actually, but also to save forests and to save time and to generally improve the quality of living. In this particular case, I'm talking about the GLPG partnership with the research programs to further document how use of LPG can reduce or minimize the health impacts associated with LPG. We are working with Clean Air Africa. It's a global health institute based in the UK, which works with the University of Liverpool, which aims to inform the national policies and scaled access to and adoption of household cooking LPG. I think if we move down there, I've also mentioned, Alfred, the screen is not full. If we make it full, we can also see, I've talked about household HAPPIN project, Household Air Pollution Intervention Networks, which is an American-backed research study on household air pollution. Next slide. Alfred. So a little bit about the Clean Air Africa, the Global Health Research. I can hardly see what you've done. I think the slides got mixed up. So the University of Liverpool has been funded to work on the Clean Air Africa program, and it's working in 3 focus countries: Ghana, Cameroon, and Kenya. In Ghana, the organization has worked with the National Petroleum Authority to look at how the sedentary resuscitation model, which is currently being worked on, can be piloted amongst the LPG users in a rural peri-urban area. And in this case, they're working in a place called Kintampo, a health facility that has been working with the University of Liverpool in the past to assess health benefits in terms of public health and household air pollution in particular. In Cameroon, the government had already worked on an LPG master plan by 2016, and therefore, University of Liverpool decided to look at LPG adoption and how it can be, to evaluate the adoption of LPG. And basically, it was to identify the potential enablers and barriers for adoption of LPG, and also to test the interventions that support the communication transition to the cleaner fuel. In Kenya, Clean Air Africa is working with the Ministry of Petroleum and Mining and Ministry of Health, and they have also contributed to the development of curriculum in the University of Health in Kenya by developing a module for community health workers so that they can include household air pollution or monitoring in the homes when they visit people's homes, or when people go to hospital, like Wanjiku alluded to yesterday. People can be asked, what fuels do you use? Thank you. The next one. So what are the indicators that we have? From what I could find immediately, we have Kenya, the usage of clean fuel is 24%. And I would like to mention that at this point that the usage of clean fuel for lighting in Kenya is about 80%, but for cooking it's only about 24%. This is, I'm talking of electricity, LPG about 23% on average, and biogas about 1%. So we're only at 24% clean fuel for cooking, but for lighting we are way ahead. We are almost 4 times higher. The disability adjusted life lost in Kenya is 1 million years, and the premature deaths by 2019 was 22,000. For a population of 47 million, that's only 7.5%. And I think that is a number that should be worrying everybody. It is the highest cause of death in Kenya, and of course in sub-Saharan Africa. In Ghana, 30% of the people are able to use LPG, and we know that Ghana is working on accelerating that adoption from what was reported yesterday by working on a standard certification model that will allow more investments in cylinders and enhance safety. The Dallas in Ghana almost have 1 million people, have 1 million years, and 11,000 mature deaths in a population of that 1 million. Next slide. I would also like to talk a little bit about HAPIN. HAPIN is a Household Air Pollution Intervention Networks. Is a worldwide study that is being done in 4 continents or in 4 countries. In Africa, it's only Rwanda that is participating, but just for mentioning that it's also being conducted in Guatemala, in Peru, and in India. And what are they doing? The Global LPG Partnership is offering expertise on LPG for these particular studies as a partner. So in Rwanda, they have selected 800 women aged between 18 and 34, which is what they're doing in all the other countries. And the purpose of the study is to identify or to find out what is the impact of household air pollution on birth weight, and also on the first year of life, because most of the childhood mortalities happen between the birth and the first year of life. So the study has been going on from 2018 and is going to end this year at 2021. And what we're looking at is these 800 women were divided into 2, or identified and divided into 2. So when they go to a clinic for their pregnancy, for the first prenatal visit, if they are between 9 and 20 weeks of pregnancy, then they are selected, and they must be in ages of 18 to 24. And they are then given a free LPG to use from that period until their child celebrates 1 year of birthday. That for that to happen, each of the households was given 2 cylinders, which are interconnected. When it is empty, the 1 cylinder is picked by the helping team, and they're left to using the other one, and they're given a replacement so that all the time they are using LPG. This is the most extensive study that has been done on the impact of health, and we are really looking forward to its end to see what it will actually show us about household use of LPG or clean air, or clean air in the household. So what happens is that the women are monitored, that they do not move to a smoky area, they do not have a separate kitchen, and because the LPG is free, they are encouraged to use anything, to cook with anything with it, including beans, which rodents eat more than anybody else in the world. So they cook everything with LPG and they're monitored. Then, in addition to the women who are expectant and their babies for the first 1 year of life, the study is also looking at mature women who live with these households. And most African households, or even in the developing world, people live with the other members of the family. So mature women are also part of the study, and they are tested for the illnesses that occur due to household air pollution, like blood pressure, and those are monitored. So the women, when they deliver, the weight of the babies is monitored. The incidences of pneumonia are also monitored, and the growth and development for the 400 women who are on LPG, and for the other 400 women who are not on LPG. The 400 women who are not on LPG are also monitored in terms of how much household air pollution are they inhaling, or are they exposed to using a gadget that is implanted or that is placed on them, and they have to walk around with it. As I said, the study was started in 2018. We've been involved in it, but it's not yet concluded, and therefore there's nothing to share. But I believe that hopefully by next year we shall be able to share what the findings will be, and hope it will be what we are expecting. So we're hoping the study will provide evidence to inform national and global policies on scaling LPG use amongst the vulnerable populations. Just to mention that this study is being conducted in the rural areas where there is no other pollution that would affect those families apart from the household air pollution if it happens. And the people who have been engaged in the study, the women will get some LPG, they will get the cylinders and the cooking equipment. And the ones who are not participating in the study will get, in Rwanda, they'll get an option of getting either some cash or some reward or some LPG they want. Just for the sake of mentioning that in India, after the study, the women who are not given LPG at the beginning must also get LPG. That is the regulation in India. So we hope that these studies will inform us on what is happening. There's something I've not put here that is happening in Kenya. We are conducting some studies on energy saving stoves, and we believe that if the energy saving stoves can save energy, then people can be encouraged to use more LPG because they do not have to pay a lot of money to spend on LPG. And we already know that in Kenya, LPG is costs a household that uses LPG spends less than a household using electricity or charcoal or kerosene, and therefore we can even save more money. Then people will be encouraged to use LPG if they have a stove, if they have cooking equipment, not just the stove, but now the pots that are energy saving. I think that's all I would like to say for today, and thank you for listening to me. I welcome any questions.
Elizabeth, thank you very much for that very, very good summary. And I just remind everybody, we have over 60 people now tuning in, and I just remind everybody to put any comments or questions you have in the box on the top right-hand corner there. You'll see Q&A or discuss, either of those two boxes, and just type away, and then we'll put the questions to either Elizabeth or Dr. Arunga, who I'm now going to introduce. Dr. Arunga is the Managing Director of Kenya Pipeline Company, and I'd like him to, if you could just unmute yourself, Dr. Arunga, and show your video so we can see you. And I just had a look, actually, what the KPC website talks about. So just for the benefit of those who are tuning in and do not know who KPC are, the company's objective, your company's objective, is to provide efficient, reliable, safe, and cost-effective means of transporting petroleum products. Well, I just had a message coming through as I was reading that out. Petroleum products from Mombasa to the hinterland. In pursuit of this objective, the company constructed pipeline network, storage and loading facilities for transportation, storage and distribution of petroleum products, including LPG. So welcome, and I'm sorry that we couldn't bring you in yesterday because I think we'd finished by the time we got in touch with you. But welcome today, and perhaps you'd just like to introduce yourself and make sure that I've got your description correct for KPC, and tell us a little bit about what KPC is doing at the moment in Kenya with LPG. Over to you.
Thank you, David. Before Dr. Muchiri goes on call, Wanjiku here.
Hi, Wanjiku.
Hi, good morning. He's the director of PIEA representing the Kenya Pipeline Company. As you heard from the chairman's address yesterday, we had the PIEA has many members, including common user facility providers, and KPC is one of them that provides the logistical part of haulage of petroleum via the pipeline. So Dr. Muchiri is personally not going to make the presentation, but he has a nominee on call. Welcome, and put on your camera and unmute yourself, and we look forward to listening to what KPC is doing in the LPG space with respect to infrastructure. Thank you very much, David, for allowing me to come in just before KPC's presentation.
Thanks for that clarification. So who are we listening to now?
Apologies, David. Regarding to KPC, we're still trying to, they have not managed to come on call at the moment.
Okay.
So at the moment on the panel, we have only Wanjiku and you.
And Elizabeth. Elizabeth's still there.
And Elizabeth, yes.
Right. Okay. All right. No worries. Well, let's hope we can get back to KPC before the hour finishes. And let's come back then to Elizabeth's presentation, because it was really fascinating to hear what's going on in Africa with the global partnership. And people do get confused about the Global LPG Partnership and the World LPG Association. Don't worry about the differences. We're all ultimately trying to do the same thing. I think that's the most important message we would want to give. Well, what I want to do is just follow on from your presentation, Elizabeth. And I don't have any slides for this, but what I do have is a little bit of background to something that the WLPGA has been doing, not in Africa, but in Asia and in Bangladesh in particular. Because if we go back 2 or 3 years, you may all remember there was an unfortunate incident in Myanmar when hundreds of thousands of refugees were forced across the border into Bangladesh, the Rohingya refugees, and they had to settle very, very quickly in temporary accommodation with the support of the UN, the United Nations, with the UNHCR activity. Along with various other non-government organizations. And within literally months, almost 1 million people had to be housed just across the border in Bangladesh by these NGOs, driven by the UNHCR. Now, the story continues that these refugees, almost, I think, 850,000 of them at one point, were all burning wood. And the wood was being collected from the nearby forests in Cox's Bazar, which is where the refugee camps are and still are. And the forests every day got further and further away from the camps as the wood was collected. Deforestation was a major issue within months. And the UNHCR, who are observer members of ours, the UNHCR formed a partnership with us to try and see whether we could transition this group, this almost well, certainly a major city, nearly 1 million people who are all burning wood, to move them across, to transition them across to LPG. And a lot of work went on behind the scenes, and to cut a long story short, it was an extremely successful program. And today, every single one of those refugees is now burning LPG and not burning wood. Now, halfway through this program, an organization based in Europe called the International Union for the Conservation of Nature, IUCN, wrote a report at the end of 2019, and it was published in early part of last year, just highlighting what had been done in the context of the transition away from wood to LPG, and what were the main benefits, what was the impact of that transition program. And I've got a copy of the report, and I've got just a couple of headlines from it, which I'll read to you. And it goes on. It says, since the introduction of LPG to displace wood for cooking in the refugee and adjacent host communities, because there was also a plan to include the communities, the Bangladeshi communities that lived around the camps, because not unnaturally, if the refugees are getting the benefit of LPG, then the host communities nearby would equally like to take that advantage as well. So the program actually included the adjacent host communities in Cox's Bazar, and it makes 4 points. Firstly, the wood demand has fallen. This is the end of 2019. I'm talking now. The wood demand has fallen from 460,000 tons a year to 37,000 tons a year. So wood is still being used, but it's a dramatic reduction from over 450,000 tons to just under 40,000 tons. That's the first point. The second point is that animal-human conflicts have decreased. And when we talk about animal-human conflicts, we know that we all know that a family burning wood, often it's the woman in the household, together with her children, who go out collecting for the wood in the early part of the day, and they have to face all sorts of dangers when they leave the camps, not least with animals, attacks from elephants and snakes, for example, when they're collecting the wood. So the second point was that these animal-human conflicts fell dramatically once people started using wood and the need for going outside the camps stopped. The third one is a really interesting one, and this is one for you, Elizabeth. They talk about, the IUCN talk about a food diversity index. Now, this is very simply, this is the indication of the mixture of the types of food that the refugees are eating. So if you're on a diet of just rice, then you have a very low food diversity index. But if you have a multitude of different types of foods and fruits and vegetables and so forth, then your index will go up. And the food diversity index increased during the period of the transition from wood to LPG, increased from, don't worry about the numbers or the units, the food diversity index increased from 0.24 to 0.34. Now, the impact of that is that with LPG, the refugees were enabling themselves to burn different types of food that would not be suitable for burning with a wood-fired stove. So the message here is that if you're using LPG, you don't just have a cleaner kitchen. You don't just get rid of your particulates, your soot, your airborne emissions, and obviously impact the health of people, and particularly with lung diseases. You actually are eating better. And with this increase in food diversity index, the refugees were becoming healthier. Their vitamin intake increased because they could eat different types of more healthier foods. Very, very interesting fact, something that we hadn't really understood up until a year ago when the report came out. We all thought, yes, burning LPG instead of wood is great because it means that you have a much cleaner and healthier environment. But it also enables you to eat healthier food, and your vitamin intake will therefore increase. And then the fourth point out of the report was that the global benefit from carbon reduction, this is moving away from wood to LPG, the global benefit from carbon reduction is estimated to be $69 million. Now, this is an interesting one. The last one is also an interesting one because we talked yesterday about the role of fossil fuels such as LPG in a net zero carbon world. And if you go to North America and you go to Europe, we spoke about this yesterday, all the talk at the moment, all the buzzwords at the moment is bio-LPG. We want to get an LPG that is not fossil-based. It's based on renewables. And there's a certain amount of work being done about that at the moment, particularly in Europe and the US and other countries such as New Zealand. So if you're looking at a program like the one that we've just described here in Bangladesh, and you can see the impact of moving away from wood to LPG, that carbon benefit, that discussion isn't really, I don't think, getting enough airspace. I think everybody's striving towards a net zero carbon world, but I think we miss the point that by introducing LPG to displace heavier carbon fuels such as wood and charcoal, for example, in industry, we're talking also about diesel and heavy fuel oil, but the role of LPG in displacing those fuels shouldn't be overlooked. So we have I guess we have an advocacy role to play here. We have to convince governments, we have to convince policymakers that yes, bio-LPG is great to have as a vision to move towards. But in the meantime, as we transition towards a net zero carbon world, then LPG has a massive role to play in displacing these other higher carbon fuels. So that's what I wanted to say on that. And it sort of links, certainly on the health side, it links quite nicely with Elizabeth's presentation. And it also brings in that aspect that I talked about just now of bio-LPG and the role of LPG in a net zero carbon world. So I don't know whether we've got KPC online yet, Alfred, but if we have, we can bring them in. If not, Elizabeth, can you unmute yourself and you and I can have a discussion, because I don't see any questions coming through in the chat box. Wanjiku.
Yes, thank you. And thank you for that presentation. And thank you, Elizabeth. So KPC, I've just sent you a chat. We have a David Murikuki who's coming in now less than 15 minutes. Well, in 15 minutes, they were at another meeting. The director to PIEA, Dr. Macharia, is held up at that board meeting. So David Murikuki is coming to make the presentation, and our technical team, Mungai, is just facilitating that seamless join in by David. Meanwhile, there is also a question for Elizabeth with regard to the study, the scope of the study, as to whether it's collecting data on bans that accrue from using other sources of fuel, and specifically charcoal and kerosene, and also the impact of these fuels on the eyes, because we seem to be concentrating a lot on respiratory diseases. And as we heard from Bassam yesterday, and as we know even here in Kenya, the data on burns and the illnesses on the eyes because of the smoke has not been collected. So we are dealing with much more adverse impact of adverse health outcomes on account of using charcoal, firewood, and or kerosene. And just to mention a little bit more is that, for example, in Kenya, while kerosene is still not largely, because then we've managed to do a lot of education and sensitization on the impact of or the adverse impact of using kerosene, is still used by a number of, especially the informal housing habitats, and the risk of using kerosene not only includes the adverse impacts it has on the user, but on the risk of the neighbors of these informal settlements. As you know, they are not constructed very far from each other, so there's no spacing in terms of the buffer to ensure that if there is a fire incident, then the rest of the houses don't catch fire very quickly, or the fire doesn't spread very quickly. But also in terms of the equipment that is used to then hold this kerosene, which we call the stoves. Sometimes they are leaking. Sometimes the wicks, or more often than not, are not the standard wicks. the people who use pieces of cloth, so you can imagine the smoking that comes with that. And also, so there's the issue of the risk of fire, the issue of emergency response that is not efficient, because even the roads that lead to these informal houses are not properly constructed. The distance between one house to another is wanting, as mentioned. So is the study taking all that into consideration, or are we just concentrating on the respiratory part of the outcome of using polluting fuels? To you, David, before Elizabeth takes.
Well, let me just add a little bit to that, Wanjiku. Thank you for that, because yesterday I showed a photograph of two little children collecting charcoal from a charcoal dealer, actually in the outskirts, in the peri-urban areas of Nairobi. And I went on a visit that day, and I took several pictures. And another photograph I took was of a young boy with I think it was a Coca-Cola bottle or a Fanta bottle, and he was collecting kerosene to take home in this open bottle. And apart from the risk of spillage, as you talk about, the other risk is that if you've got a liquid sitting around in the household, in a Coca-Cola bottle or a Fanta bottle, particularly a Fanta bottle, which I think is orange, isn't it? It looks very similar to kerosene, and there's always the risk of ingestion of kerosene by young children accidentally, because it happens to be in the same bottle that they would ordinarily drink their soft drinks from. The risk of fire, absolutely. I think, and that goes for LPG as well. I think any cook stove, whether it's burning wood or charcoal or kerosene or LPG, I think there has to be a massive education program. And this actually took place in the refugee camps. I didn't cover that point, but when you're transitioning people away from a traditional fuel like wood or charcoal, you have to educate them in terms of how you store and handle and use this new fuel, LPG, which is is pretty well invisible. And when you compare the different types of fuel from traditional fuels to gas, it's very different indeed. So it does need explaining, and it does need very often. I saw it in Indonesia, and I saw it in India with the big transitions there. It often is best done with demonstrations. So you have a small group of households just seeing how an LPG stove operates, how it's lit, and how you check for leaks and so forth. So lots of risks in any fuel that we're dealing with, but the repercussions of burning other fuels such as kerosene and charcoal. Yes, you're right, Wanjiku. It's not just respiratory problems. It's burns and it's as you say, eye damage as well. Elizabeth, are you there? Have you got anything to add to that?
I lost connectivity for quite some minutes. I left when you were talking about Bangladesh, and yes, I hope you talked about the nutritional benefits for LPG, which I learned about, that the Rohingya refugees, apart from getting a clean air pollution, they also derive some benefits. They also observe some nutritional benefits amongst the population. And this was treated with LPG. It was unexpected. There's anybody who had ever looked at it in terms of the families that use LPG. Do they cook better food, or do they cook more food? I hope that is what you talked about, and I would be looking forward to share what you have in terms of LPG and nutrition benefits, which I didn't talk about because of the time constraints. But thank you very much. So I've missed a bit of what you're saying, and maybe if you have a direct question, I'd be more than willing to answer it or to comment.
David,
Sorry.
your microphone is...
Yeah, sorry, Elizabeth. You reminded me there of something that I was told by people who had just some of the refugees who had just converted to LPG, and one of them said that when their families are not at home when the meal is cooked, then it's very, very easy to reheat the food using LPG rather than charcoal or wood. So the whole flexibility of eating is suddenly improved because LPG, as we all know, we can light the flame, and when we finish cooking, we turn the flame off. Unlike charcoal and wood, which has to be sustained until the next meal. It's really interesting that they found that as a massive, well, not a massive, but certainly an important benefit to be able to reheat food very quickly when the rest of the family come in after the main meal has been eaten. So yeah, I mean, I think we're all advocates of how good LPG is a cooking fuel, and we mustn't forget also that it has a very, very hot flame. So it can be used for cooking stir fries and wok cooking very, very well. It's an extremely well. It's a perfect fuel for cooking, and that's why nearly half the world's demand is used in the cooking sector. So I'm looking at the questions. We have a question.
As you look for the questions, David, there was an issue about the scope, the coverage. She missed that in terms of is the study just covering respiratory? Is it covering burns? Is it covering impact of eyes? Is it covering other risks that come with the fire? And what you've just talked about in terms of poisoning, which has been such an issue here, though very unrecorded, where children, because the containers are normally those that have been reused. They may be containers, bottles for water. They could be actually containers for oil. We've had an incident, and not one, where kerosene has been stored or purchased using a reused cooking oil container. And because the containers are kept in close proximity at the kitchen, then the user actually poured kerosene into a hot sufuria, and you can imagine what became of that, and it led to a slum fire, blah, blah, blah. So apart from ingesting it, there's the risk of then confusing the kerosene that is stored in a cooking fuel container, for example, cooking oil container, then morphing into a disaster. So I think the scope of so maybe Elizabeth can answer that, and just as she prepares to answer that in terms of the coverage of the scope, whether it's respiratory or other issues. I think for me, the brand owners that are on call and have been on call since yesterday, I think we need to look at repackaging how we promote and sell LPG. Because whenever we are talking about it's safe, we're talking about LPG, the product itself. But we don't say it's safe because then there's no risk of it being ingested. There's no risk of it being confused for cooking oil. There's no risk of it, leading to destruction of poverty, death, burns, etc. Because we are always clamoring for increase in sales, but we should also clamor for increase in safety in the home, and especially safety in cooking. I mean, no one needs to die because of preparing or cooking a meal. And I think we really need even to repackage, David and Elizabeth, how it is that we advocate for government to continue paying attention to these cooking fuel. And we didn't wake up to very good news here in Kenya. My colleague David Njogu just showed me the headline of the Business Daily, where one of the conditions by IMF on the loan that the country has signed off to and that will be disbursed, or if it hasn't already been disbursed into the Kenyan accounts, is that Kenya must impose 16% VAT on petroleum products. And I'm thinking, we just came from pitching at the National Treasury 3 weeks ago to defend our proposal to have a stay on the zero rating of LPG now that we gained that approval last year. But there was an indication that it could be imposed this year, and it has become apparent that it could very well be. So we are positioning ourselves today to put up a fight. And I think the discussions that we had yesterday and today are giving us sufficient, ammunition to actually put our case forward. So back to you, David, before Elizabeth then takes on the coverage of the scope. Thank you.
Yeah, well, before I ask Elizabeth to jump in, that's really bad news, and I think if there's anything we can do to help on that front, Wanjiku, let us know, because that's something that is really a backward step. We talked about this yesterday. Yes, LPG is a fossil fuel. Yes, we know that, but it's a 5-star fossil fuel, and if you can back out more higher carbon fuels such as diesel and fuel oil and coal and charcoal, and displace it with LPG, you are contributing towards a net zero carbon world. And that addresses Hilam's question. He said, what will be the role of LPG in near zero carbon world? Does this affect the future of LPG? Well, I think in the short term, Hilam, we've got a job on our hands. We've got to promote the use of LPG in displacing higher carbon fossil alternatives. So this, if you like, is we're in the fossil ring, and we have to make sure that we're beating up everybody else who's higher carbon than us. Stepping outside of the ring into the non-fossil world, this is when we bring in bio-LPG and renewable LPG. But I see that more of a longer-term goal than the more immediate future, which is the one that Wanjiku has just alluded to. And then there's another question coming from Kelvin. He said the price should be reduced to gain more ground on slum areas. Well, if you heard yesterday from Nick Quintong from Pago Energy, his work that he's done with smart meters in slum areas has actually proven that LPG is actually cheaper to use than charcoal and wood. And the reason for that is that, as I said just now, you turn the flame on and you cook and you turn it off again, whereas you're sustaining your flame throughout the afternoon if you're cooking lunch and then dinner with charcoal. And I think the numbers that Nick publishes is something like, it's like, in terms of shillings per meal, it's about half the cost of charcoal.
Absolutely.
LPG. So we have a myth here, and we need to bust it. We need a myth buster to say that.
Absolutely.
Hey, and this is not subsidized. This is not subsidized LPG. This is market related, market priced LPG. This is this is not what we're talking about in Indonesia, which they have a subsidy on LPG in Indonesia. But no, this is the market price. And
absolutely.
Yeah. So,
David, if you'd allow me, on the issue of, you're right, it's a myth and we need to bust it. And it's a narrative that is advanced by people who want to continue deceiving the populace that LPG is expensive and that it's an aspirational fuel. And that's why you will find that even the government will continue to tax it, because they're thinking that if it's an aspirational fuel, then it's not the most popular fuel for the masses, which is wrong. And I think the reason why we have forums like this is for us also to empower ourselves with the truth and the facts, stay away from the myths, and become advocates of the truth. And apart from what Nick Quinton said yesterday with respect to how much, saving that one makes from using LPG. Remember that in Kenya, and I mentioned that when I was doing the presentation in the morning, we actually did, it was very rudimental, but discovered that LPG is actually cheaper than the clean cook stoves, which is the alternative that is always pushed down our throats by people with vested interest to get their manufacturers make a kill from sub-Saharan Africa on the so-called clean cook stoves. They don't use clean fuels. And I'm happy that we're having this conversation when Elizabeth is on call, because she was one of the people who also did this study. And what we found out is that a so-called clean cook stove that doesn't have fuel, because it means you have to buy the charcoal or the husks, whatever it is you're using, is approximately $40. If you look at the 6 kg, a cylinder that comes fully equipped with a gas, it has the grill, it's it's a plug and play. It's actually cheaper than the so-called clean cook stove. When you don't even put in the fact that it's going to, cook cleaner. It's not like charcoal, as David is saying, which then you would need to either put off by pouring cold water and perhaps drying it again, of course, which we know is not feasible. With your gas, you will put it off and cook for longer. And there will be no bill that you'll have to pay for colds, for pneumonia, and whatever else that your kids or your wife or yourself will contract from the toxins that are emitted from using the so-called clean cook stoves that use dirty fuel. So I think the onus is on us to please bust that myth. Also remember the East African study that was conducted by the Global LPG Partnership, and which was also referred to yesterday by India Athi. They also had the same study. The biggest concern, even for the low income groups, is not the price. They understand the benefits of LPG so far, and they understand that there is no cheaper cooking fuel than LPG. The concern for them is, one, safety, which means we have to take it upon ourselves to ensure that the cylinders that are deployed in the market are safe for consumer use. The other concern is reliability of supply, that when I run out of my LPG, it will be refilled so that then I don't have to, equip my household with kerosene or charcoal fire in the interim as I wait to procure. The third one is actually cost comes at the tail end of the pyramid. So again, even for the consumer, they are well aware. So I think the onus is on us, and I've said that we need to package, we need to debunk, we need to bust these false narrative, as David is saying, and the myth, and advance the conversation about the benefit of LPG. But apart from advancing the conversation about the benefits of LPG, which are becoming clearer and more apparent to both the consumer and to the policymaker and regulatory agencies, we need to ensure that we avail LPG at the point of purchase for every consumer, so that they make an informed choice at any one given time when they want to refill their cooking fuel requirements.
No, absolutely. And there was a really good discussion about that in the supply chain innovation session, the panel session in the morning yesterday, about what's happening in terms of getting the product close to the customer, so that if they do run out, it's only a matter of minutes before they get resupplied. And of course, Circle Gas and Paygo Energy will say, well, they will never run out, because we'll make sure that we replace that cylinder before the cylinder is empty that they're using. Elizabeth, are you still there?
She was on, then I think she's having network issues. She was on,
yeah, maybe.
Then she left. Maybe
I was going to ask her about that scope extension that you talked about. I can tell you that the report that I referred to was done just a year ago, and they were so keen to get it out, the IUCN report, that they were really focusing on the basic health issues. I don't think they drilled down into any further details like the ones you described with respect to eye damage. But who knows? That might be stage 2. That they were very, very pleased with the outcomes that they got from the first report. And this food diversity index one, it really threw us all, because we had never really thought about that. And now we can, and this is not a myth, we can say to governments, look, if you cook with LPG, your people will be healthier. They will have a higher vitamin intake, because they can cook more healthy food with LPG compared to coal and charcoal and wood. And that is a fact. And there's a report there to back it up. So I think we should continue to press that message out whenever we get the chance. Still no KPC, Wanjiku?
No, the last I know from a technical team. Oh, I can see KPC. Oh, he's on, David Murikuki. What do we know? Thank you, David. So I'll pass it back to you, and then you can invite David Murikuki.
Hi, David. Nice to see you again. It's been a little while.
Sure.
I think the last time I had a discussion with you, I think it was about visiting the Mauritius terminal from with Petrodec.
Way back 2017.
That's right. So tell me, what's new with KPC these days?
Thank you, David, and good to see you after such a long time.
Yeah.
I think after that good introduction you did for us to Petrodec, which was a very big success for us, we restarted our journey, which had started a while back, as you know. But we really haven't done too much, but we still have hope. We are more or less almost where we were then, but we have more goodwill from the government now, and with the support of Wanjiku, thank you very much. We are still, as we had planned, we want to do a facility in Mombasa. And now we have a lot of support, which we are hoping to start probably within this year, and do another facility in Nairobi. But then immediately after that, we also want to, to go all over the country where all our depots are. We want to do that, but initially we want to start with Mombasa. We have started by getting an import line from the new jetty. Probably you're aware that we are doing a new jetty where we have a gas pipeline coming in. Yeah. And we have a lot of interest, even from other players who would want to use the facility. But being KPC and being government, we are at an advantage position because also our drive also is to make gas more affordable to the Mwananchi. I don't want to use Wanjiku because Wanjiku is here, but that's the common name we use for Mwananchi here. So where we are now is that everything is set, waiting for budget disbursement from the National Treasury, and then we can start off, hopefully within this year. And there being a lot of interest in this field, this time we want to ensure that we actually are at the forefront of doing this. Because this is also going to support the government agenda on health and industrialization and these other pillars. So that is where we are, and this time we have more confidence that we are going to do this.
Excellent. Also, what sort of size, David, are we talking about now?
We want to do a 25,000 ton as an interim. But we want to leave a position for upgrading. In our mind, we thought about going to 50,000. But one of the things that we are going to do in the interim is that we also want to rerun the demand numbers so that we see where we are, because that projection was what we had used about 2 years back. So we'll be running the numbers as we continue the facility so that we see at what extent that we want to do for the Mombasa facility. Nairobi being more or less of a distribution point, we are looking at doing around 10,000 tons. And then we will go into the regions with different sizing depending on how the numbers will turn out after we do our study. David?
Yeah, and I guess your study will also take into account the possibility of trucking by road into adjacent countries such as Uganda.
Precisely, David, and something that has happened in the recent past is that Kenya Pipeline and the Kenya Railways and Kenya Ports Authority have been brought together under one company called Kenya Logistics Network. So we are going to use a lot of synergies, especially between Kenya Pipeline and Kenya Railways, who already have a track all the way to Uganda. Now that the track actually passes just alongside our Eldoret depot, we are hoping that we will have a bigger facility in Eldoret that will be used for transit into Uganda. So that's primarily how we look at getting to the region. About road transport, as KPC, we are not likely to look into that. Probably now that we leave it to the people who are doing the last mile, the oil marketers, so to speak.
Yes.
Our mode of transport initially will be rail. From Mombasa, we use the rail to Nairobi, and then we do that to the western of Kenya. So road transport, you haven't looked at it as much.
I think it's a sensible move. A lot of LPG is moved around Eastern Europe by rail very successfully and very safely. And it takes trucks off the road, and we all know that we get incidents on the road sometimes with bulk road tankers, which we must try and avoid. So it's really interesting to get updated, David. I guess in the last couple of years since I spoke to you about this, the demand has gone up, and your projections are probably looking a little bit bigger now than what they did 2 years ago.
Yeah, precisely. That has happened, David, since the last time we spoke. I may not have the numbers right away. I'm sure maybe Wanjiku might be having a more recent number, but we like I mentioned, one of the things we want to do with this project is to run the numbers and see where we are, so that we have a more precise infrastructure that will cater for that, and probably for the next couple of years, because I'm sure once these projects come up and going by what is happening in the country and the region, then we'll see, of course, quite an escalation in the demand. So those are the factors that we want to project.
Excellent. Really
David,
good.
Is David of KPC able to share with us some timelines, some anticipated timelines, or some expected timelines on some of the activities that are lined up, even as we await the budget approval for the brick and mortar, bearing in mind that there was already an allocation for some of the studies, related studies to be undertaken? Are you able to just give some timelines? They may not be absolute, but they may help in especially planning for persons who have been waiting and relying upon this project to actually make some good traction and to be.
Yeah. We can tentatively probably give some indication, is that for the Mombasa project, which now it becomes our key starting point into this LPG project, we are looking at when we do groundbreaking this year, we should be able to commission around the end of 2023 or probably latest 2024 there. Then what we want to do is that as soon as we start on the Mombasa facility, then immediately want to kick off the Nairobi facility, and this one we are looking at around 2022 July. Being a smaller facility and having gone through the project learning for the Mombasa one, then we are thinking that the commissioning will just be around the same time for these two. Then for the ones in the region, those ones we haven't put in timelines. We are at the planning stage.
Good. Wanjiku, I think we've come to the end of our hour. I don't know whether you want to ask David anything else. I'm just conscious of the time. And the only thing I'd like to add is that, and David will relate to this, we were planning to have our WLPGA workshops this week. And I know that you've attended those in the past. And we're planning to reschedule them now. Early June, I think, is the date that we've set, Wanjiku. Yes. Early June. So if anybody is listening, we've got over 70 people online at the moment, so there's a good advert here. If anybody's interested in joining these good industry practice workshops, then please get in touch with PIEA for more details. And we hope to run those. Unfortunately, I don't think I'll be coming to Nairobi this year, but we'll be certainly doing them again on a virtual platform in June. And God willing, we'll be back in Kenya next year. And yeah, that's all we can hope for. So over to you.
I think the other thing is, I don't know if you want to check if there are any questions for David Murikuki from KPC, but perhaps what I'd just like to again request David Murikuki from KPC to do. We've just discussed this before you walked in, David. Today, after having a very spirited fight in the last so many number of years in, years out, and last year we put in a fight again and had the National Treasury staying the proposal to impose 16% VAT. Today on LPG, today, as you may be aware, the country has woken up to again headlines that one of the IMF conditions in disbursement of the loan or unlocking the loan, we suspect it's already been disbursed, or for utilization of that loan for that matter, is that the government must impose 16% VAT on all petroleum products. And our appeal here is that we must make a concerted effort, as you know, through the Secretariat, as empowered by the Board of Directors, KPC being one of the board members. We are going to put up a battle. We've been relentless. But what we are seeking here is really support from especially public entities such as KPC, because you really do have the year of the highest office in the land. And we have articulated since yesterday well-known facts about LPG. This forum has also discovered that there are other justifications as to why, apart from health and environmental conservation and education and dignity and food production, climate action, that go on to buttress why the country must go to making LPG the primary cooking fuel by a target that was brought forward by actually the Ministry of Energy, not even the Ministry of Petroleum and Mining, in 2019, from 2030 to 2020. So what's our point here? You must take the battle on for us as well. This is KPC, the most powerful entity with respect to oil and gas in the region. And we are seeking your support. If you could just take this back to the director and all your board members on what's cut out for us in terms of a battle royale with government as to why we must leave LPG out of the 16% tax imposition. And that's all that I would like to submit to you. And secondly, of course, for members and those on call to please register for the Global Industry Practices Workshop. This is important because, as you know, it's a regulatory requirement, at least in Kenya, to actually have these annual trainings, and we do issue certificates, and especially for those who have storage and LPG refilling plants, it's a requirement, and I think KPC can also ready itself by having the persons who are going to take charge of these facilities trained in advance, so that all they'll need to do in the second or upcoming years is really a refresher. And you know that LPG is so dynamic, just like any other fuel, in terms of emerging issues that come from safety, issues that come from operations. And we're always so blessed to have David Tyler, who's actually the key resource person in this. And now companies are going to save money by not having to either come to Nairobi or come to Kenya for that matter. It will be online, and this is just an appeal for people to sign up to these workshops that we have deferred to June. So David Murikuki, I don't know if you'd want to make a final submission, and also Elizabeth Muchiri, before we hand over back to the key moderator of the session, David Tyler. Thank you very much.
Thank you, Wanjiku. And just as my closing remark, first of all, is to say that, you have come a long way together, and you have my support on this. And I'm going to escalate it to wherever is necessary to do that. And number two, then, as we do that, I think we still continue to cooperate on these areas, the connections at KUT and everything else around the LPG. So we'll work together, and I'm sure this time you're going to go to get this right. About the upcoming forum, then we will be represented. So that's all. Thank you.
Thanks, David. Elizabeth, are you still with us? Can you hear us?
Yes, I'm still with you. And sorry, I seem to be having issues with the internet, but I've now connected to my phone. That means I should be able to talk. So one of the things I would like to say, and in the interest of time, I would like to talk about the item that Wanjiku has talked about on VAT on LPG. The government needs to be reminded that if we put VAT on LPG, we are going to make it expensive, and we are going to have many more cases of Murage. Mr. Taylor, I don't even know about somebody who was trying to steal his baby from hospital because he could not pay a bill of $500 after his 1 month old baby had been admitted with pneumonia. And when the pressmen went to his house, they found charcoal stoves and kerosene stoves, and that is the sort of fuels that are used by people who are, if they are not able to afford LPG. And the government really must consider that if it will, like they were trying to do the Manyara project, give people LPG and then reduce the health bill, improve all the nutritional benefits, the red dye, time for cooking, and so on. So really that must be emphasized, that we cannot afford to make LPG any more expensive than it is. And we already know that it's affordable, but we don't want to put a perception that it is expensive, and especially because of that most of the people must still be able to buy a full cylinder, and that input of 700, 800, 900 shillings for a 6 kg could be a lot of money if VAT is added. So that really must be the message that we must pass on. The other point is safety. I know we have not done any studies in Kenya yet, but going to the case that you talked about of Indonesia, from what I've read, they had recorded far fewer accidents from kitchen fires after converting to LPG than when they were using the other fuels. And that's also the message that we must put, that LPG is a safe fuel in terms of kitchen accidents, in terms of household air pollution, and so many other benefits. And usually we cannot afford to lose those benefits for any reason. In the interest of time, I would like to say that, and I would like to wish KPC all the best in the project of putting up a storage facility. We've been waiting for that facility for the last 10 years, from the time we saw the first advert in 2011 or 2012. So it must be time there for KPC to put up that facility. And finally, on LPG, and I know LPG has been penalized in the world because it's called liquefied petroleum gas. We know in Kenya we're using more butane than anything else. And from the presentation yesterday from Agas, our LPG is coming from America, where they have shale gas, and it's actually coming from natural gas. That is political, but we are not using petroleum gas, we are using butane from natural gas. Thank you.
Yeah, thanks, Elizabeth. I really find it hard to explain sometimes to people that LPG is not the same as natural gas. I think we're all LPG advocates in this group, and we take it for granted. One of our challenges is to take that message outside of the group into the street and educate people of the benefits of LPG, particularly so with this news that you've just told us about Wanjiku, which is really disturbing. And I think one of the things I'll be doing when I get off this call is talking to James Rockall about whether we can have some sort of input to the IMF on this, because it really is, it falls very squarely in our advocacy program. We have 3 goals, as I mentioned yesterday. Advocacy is one of those goals, and what we must try and do is tackle this real issue that we have, that LPG is a fossil fuel, but it's a 5-star fossil fuel, and it can displace higher carbon fuels such as diesel, fuel oil, coal, charcoal, and make a big contribution towards a net zero carbon world. So that's one of the things. And the other thing is, I wrote down here, the myth buster, that LPG is more expensive than charcoal. It is not. It is not. Ask Nick Quintong from Paygo Energy. He's done the work. LPG is actually cheaper. Shillings per meal to cook with LPG is cheaper than cooking with charcoal. And David, lovely to catch up with you again, and thanks for the update on the storage initiative and the other logistical plans that you have. Good luck with the budget proposal, and we look forward to seeing that eventuate in the not too distant future. Wanjiku, lovely to work with you again this week, and look forward to the June program when we can get together again. And for those of you online, and we're nearly 100 now, it's really interesting how the numbers have built up. Perhaps they've heard the discussion out there in the network. So please carry on interrogating this platform, the exhibition, and the meeting rooms. And from me, I think that's all I have to say, other than thank you so much, PIEA, and for you, David, this afternoon, coming online and catching up with you again. And look forward to catching up with everybody again soon. So do you want the last word, Wanjiku? You normally have the last word when it comes to discussions with me.
Thank you, David. Thank you, David. And thank you, David. And thank you, Elizabeth. What can I say other than it has, as usual, been a very fascinating 2 days. There is always something to learn, and it is so comforting and consoling that we actually have the world as the wind behind Africa's wing in trying to get LPG into every home. Thank you very much, everyone, and God bless you.
Thank you. Goodbye.
Bye.